Hello. This is Dr. K, Dr. Kusuma. My father has a full head of hair, but unfortunately, as the eldest, I inherited male pattern baldness. And so I'm doing a follicular unit explantation and transplantation of hair from my back of the head and sides of the head. I'm going to try to do it in the front and space it out in the crown and the vertex area a little bit to give it a bit more density. Obviously, I'm doing it under local anesthesia. It's a bit uncomfortable with the injections at the beginning, but right now I don't feel anything. You just have to be patient and just lie down, and it's a slow process. The whole thing takes about 6-7 hours to do, probably, because I'm trying to do about 1,600 to maybe 18 to 2,000 grafts depending. So right now what's happening is the extraction process, and so there's no big strip that's cut out. Actually, it's just individual follicles are extracted with this machine called NeoGraft, and they're separated, and then I turn over and then we start inserting it in the front. But I'm going to take a break and have a 15-minute break in between the two. So this is the NeoGraft hair transplantation, follicular unit explant and transplant process, not the strip process.
And we're doing this right in the OR at Suria and Plantation.
Yeah, the success rate of this particular technique is rather high. It's over 90% success rate. So over 90% of the patients get over 90% take or success of the grafts that are transplanted. So it's a very successful procedure.
Can you explain a little bit about how the process works?
Yeah, it's going into the canister, so you can see them here. See, these are actual grafts, and they get sucked into here. When you extract, so the great thing about this one, it cores it and it suctions it out, so you don't have to go back and individually take one out, kind of like the artist robot. This one, it sucks it by itself, so it takes out a lot of the time. Then I'll just get some in here. I keep them hydrated with the saline, and then I'll just go until I stop. This is the slowest, longest part.
What do you do after this is complete, post?
Well, I mean, it's going to be a little difficult to sleep because obviously, I'm getting the hair units, follicular units, explanted or taken out or, harvested from the back and a little bit on the side. And I'll be transplanted in the front. So there's no good position to really sleep. So it's going to be a bit tough for the first 2-3 days and maybe a little bit of pain. I'm going to take Tylenol. Eat normal food, walk around, and probably be bored or read or do something just to hang out. And after 3 days, it should start improving. I can gently start washing my hair and using some Rogaine. In the meantime, I'm going to use some basic saline spray or something to just keep the area a little bit moist so it doesn't crust up. And I'm going to start using some Rogaine maybe in a month or so. And I may even try some PRP because although there's been anecdotal reports that it helps, I'm not convinced, but I'm going to try it out and see. And for that, I'm going to use this device called the celling device, which concentrates the growth factors and the buffy coat or the platelets and makes it very rich. And I'm going to inject it into the scalp, and I'm going to try it on myself and see how it goes. I'm going to go back to work on Tuesday. Monday is Labor Day, so today's Friday. I'm going to go back to work and start operating on Tuesday.
What's the approximate cost for this procedure based on the different areas of coverage?
Well, coverage doesn't matter so much. It's really priced by the follicle. Each follicle has a unit price of X amount, and it varies, depending on the geographical area, etc. But on average, it's about $5, sometimes $7 a follicle, and so it just depends on the number of follicles you get. So, for example, if you do 1,000, it may cost 5,000. If you do 10,000, you don't do 10,000, but if you do 2,000, it'll be 2,000 times $5, $7, depending on the geographic region, and that's how it's typically priced. And obviously, the question that can be asked is that how do you know how many are needed, and that's based on consultation and estimation and the areas that need to be done. And most of the time when we do this, we only do about 3,000 or so maximum at a time, because it's a long process, it's a tedious process. As you could see, individual follicles are taken out and put in, so it's a very, very precise, tedious process. And the density of the transplantation also matters, and the donor site also matters, right? So all these are considered, and you can do it more than one time. Sometimes people do it 2-3 times depending. So you can break it up into sessions and do as much as possible.
Is this something that women have used as well that have instances of hair loss?
Absolutely. Women can do it as well. Actually, you could get very, very precise, and you could do eyebrows, you could do hair, you could do specific surgical sites that need hair, and you could do some balding, and put some density in women as well. The process is fairly similar to males, and the consultation evaluation is similar, and you could do females absolutely. So when I was in training, back in early 2000s, mid 2000s, we didn't have this technology at the time, and one of my attendings or my professors used to do hair transplantation the old-fashioned way, where you make a big strip cut, stitch it up, and manually extract each one. And I never liked it. It was a very crude process. It was not precise, a lot of human error. And so I never wanted to offer it to patients. But when this technology improved and we have better machines like this NeoGraft, I started offering it to patients. And as you can see, I'm doing it myself because I believe in it. It's also, I think the precision of placement is very flexible now because of the follicular unit explantation and transplantation. So this is a great procedure for male or female bald, hair loss.
And do you perform this on patients, or is this performed by someone who has to have specialized training?
Well, it's a team effort, right? I'm the physician. I guide, I consult, I kind of create the plan, and these very, very experienced techs do this, and they've been doing it for over 20 years. So it's almost like a little bit like orthodontistry, a little bit, where the orthodontist is the consultant and kind of guides the plan, but the technicians do a lot of the work. It's a very similar process in hair transplantation these days, because it's a repetitive process, and people who do it a lot get really, really, really good at it. And so it's a team effort essentially.
So explain what a hair transplant really is.
There's probably a bit of confusion, that a transplant essentially is something where you can get hair or fat or whatever from other people, like family members or friends or something, is a common joke. But you can't do that. I mean, any transplant is very similar to a kidney transplant or anything else, because the body has to, accept whatever a transplant it is, and it's really like, the same person has to donate what they want to transplant. So you can't get things from others to transplant this, and if you do that, of course you shouldn't do that, and then you have to have immunosuppression and all those sorts of things that we don't want to do, because this is an elective cosmetic essentially procedure. So in kidney transplant and other organ transplants, it's a necessary thing for living, and therefore you can get other people's that are matched, and you can take drugs to suppress the rejection process. But in these procedures, the donor is you and the recipient is yourself, and so we don't take it from other folks to do these kind of procedures.
So it's more like just reallocating the follicles from other areas to the areas.
Yeah, it's just like fat grafting. I love doing fat grafting for the face, for the breasts. I do that a lot, and this is no different. You get it from a place that you have something to spare, and then you put it in a place that needs it. And so this is almost exactly like fat grafting. So I'm getting it from an area that I can spare in the back and the side, and putting it where I don't have it in the front and then on the top. And so fat grafting is exactly the same. It's a twofer. You get fat from places that you don't want to have. You process it and put it where you can gain advantage, and get some fullness. And so these are great things, because it's really utilizing your own body's, tissues, cells and all kinds of good stuff to put it where you need it.
Well, we look forward to following up with you next week and checking out your new hair growth.
Yeah, I mean, also for preparation, people want to know. I mean, I'm awake and I'm talking, obviously, right? So sometimes, we give a little Ativan or, sometimes even a little Percocet or Vicodin before doing it if people need it. Personally, I didn't take anything. I just wanted to experience and see what it was like. So I didn't take anything this morning. I just had a little bit of, a smoothie that I drink in the morning, and that's all I had. And last night I had a normal dinner, and I'm going to go home after it's done, and hopefully my wife prepared a very good meal.
All right, thanks, Dr. Kusuma.
Thank you.